Cerebral palsy. Did you know cerebral palsy is not a disease, but a collection of symptoms that result from damages to the brain? Cerebral palsy is more common in infants who are premature or have very low birth weight. Brain damages that occurs after age 5 is not considered cerebral palsy. Life expectancy is usually normal. Cerebral palsy is a group of disorders that involve brain and nervous system functions, such as movement, learning, hearing, seeing, and thinking. There are several different types of cerebral palsy, including the following. Causes. Cerebral palsy is caused by injuries or abnormalities of the brain. Most of these problems occur as the baby grows in the womb, but they can happen at any time during the first 2 years of life while the baby's brain is still developing. In some people with cerebral palsy, parts of the brain are injured due to low levels of oxygen in the area. It is not known why this is caused. Premature infants have a slightly higher risk of developing CP. CP may also occur during early infancy as a result of several conditions, including bleeding in the brain, brain infections, head injuries, infections in the mother during pregnancies, severe jaundice. In some cases, the cause of CP is never determined. Symptoms. Symptoms of CP can be very different between people with this group of disorders. Symptoms may be very mild or very severe, only involve one side of the body or both sides, be more pronounced in either the arms or the legs, or involve both the arms and the legs. Symptoms are usually seen before the child is 2 years old and sometimes begins as early as 3 months. Parents may notice that their child is delayed in reaching and in developmental stages such as sitting, rolling, crawling, or walking. Other symptoms include abnormal movement of the hands, feet, arms, or legs while awake. They get worse during periods of stress, tumors, loss of coordination, floppy muscles, especially at rest, and joints that move around too much. Other brain and nervous system symptoms: decline, intelligence, or learning disabilities are common. Intelligence can be normal, speech problem, hearing or vision problems, and seizures. Signs and tests. A full neurological exam is critical. In order people testing functions is also important. The following other tests may be performed: blood tests, CT scans of the head, EEGs, hearing, scenes, MRIs of the head, and vision testings. Treatment. There is no cure for cerebral palsy. The goal of treatment is to help the person to be as independent as possible. Treatment requires a team approach, including many of the following. Self and home care include getting enough food and nutrition, keeping the home safe, performing exercises recommended by the healthcare provider, practicing proper bowel care, protecting the joints from injury. Putting the child in regular schools is recommended unless physical disabilities or mental development makes this impossible. Special education or schooling may help. The following may help with communication and learning: glasses, hearing aids, muscles and bone braces, walking aids, and wheelchairs. People with cerebral palsy have to take many medications for seizures, drooling, and tumors, and in some cases surgery may be needed. The child with cerebral palsy at school. The most important aim of including students with cerebral palsy in the mainstream school settings is the development of social confidence and self-esteem with full access to the school's curriculum. The students who have medical development and psychological conditions may need additional support to enable them to engage in learning on the same basis as all the other students. The disabled standards describe the obligations of the school to provide the necessary adjustments to support students with additional needs. This support may be in form of healthcare support, learning support, or combination of both. Expectations. Cerebral palsy is a lifelong disorder. Long-term care may be required. The disorder does not affect the expectation length of life. The amount of disability varies. Many adults are able to live in a community either independently or with different levels of help. In serious cases, the person may need to be placed in an institution. Prevention. Getting the proper prenatal care may reduce the risk of some rare causes of cerebral palsy. However, dramatic improvements in care over the last 15 years have not reduced the rate of cerebral palsy. In most cases, the injury causing the disorder may not be preventable. Pregnant women with certain medical conditions may need to be followed in a high-risk prenatal clinic. Data and statistics. About 500,000 to 800,000 people in the U.S. have cerebral palsy, making it the most prevalent developmental disability in the country. About 5,000 infants and toddlers and about 1,200 to 1,500 preschoolers are diagnosed with cerebral palsy each year. Here are some more CP statistics. Between 2 and 4 out of 1,000 children born are affected with CP. About 10,000 babies per year in the U.S. will develop cerebral palsy. More boys are born with CP than girls, by a little over 30%. Roughly 50% of people born with CP are premature babies. Over 50% of children with CP have leg weaknesses. Nearly 1/3 of children with CP cannot walk. About 30% of children with CP are paralyzed on one side of their bodies. Nearly 1/3 of children with CP have severe learning disabilities. Near 2/3 of the people with CP have normal or super intelligence. 25% of people with CP have seizures. 25% of people with CP cannot feed or dress themselves. 1 in 9 people with CP may be autistic. 1 in 11 people are legally blind. 1 in 20 people have tumors. 1 in 50 people with CP are dead. The average lifetime cost of a CP is over $900,000. The support color for cerebral palsy is green. The following are support groups of cerebral palsy: International Cerebral Palsy Association, Cerebral Palsy International Research Foundation, the Surveillance of Cerebral Palsy in Europe, My Child, and United Cerebral Palsy.
I dedicate this presentation to Halisha, an awesome person that has cerebral palsy.